A female in her 30s with an enlarging left labial mass. A multigravida, which is a woman that's pregnant and has had two or more babies. A multigravida African American female in her 30s presented with a 4 month history of bleeding during intercourse. She also complained of external irritation secondary to an enlarging left labial mass. She had recently removed an intrauterine device due to malposition secondary to the presence of submucosal fibroid detected on an ultrasonography. She also had a, a slowly enlarging cervical polyp. Pelvic examination revealed a 3 centimeter fluctuant, soft mobile raised lesion on the left labia between the labia majora and the labia minora. The surrounding vulvar tissue appeared to be normal. Patient's past surgical history was significant for bilateral breast reduction 5 years back. When fibroadenomas adenomas with fluoroductal epithelial epithelial hyperplasia were noted in both breasts. The vulvar lesion was first biopsied, then completely excised, along with a polypectomy, which is the removal of the polyp of the cervical polyp. Transvaginal pelvic ultrasonography performed the previous year was significant for leiomyomatous, which is a benign tumor made out of muscle tissue. So, gross examination of the excised lesion revealed a well circumscribed tan white polypoid mass measuring 2.5 by 2.3 by 2 centimeters, just beneath an ellipse of wrinkled, disrupted skin. The cut surfaces were gray-white bulging with numerous slits. There was grossly no hemorrhage or necrosis. Let's see, hematoxylin, which is a yellow dye, and eosin, which is a red dye, section revealed a well circumscribed biphasic lesion between the unremarkable skin. The benign fibroblastic stroma was surrounded by compressed ducts, which were mostly displaying intracanicular pattern. The glands were lined by luminal columnar cells and abluminal myoepithelial cells. Immunohistochemical stains revealed that the ductal epithelial cells were positive for GATA3 and negative for PAX8. The myoepithelial cells showed nuclear positivity for P63 and cytoplasmic immunoreactivity for smooth muscle myosin heavy chain. Ki67 labeling index was very low. So, full diagnosis. Fibroadenoma of the vulva is exceptionally rare occurrence. It is a breast-like benign biphasic fibroepithelial neoplasm composed of epithelial glandular component and stromal component. The neoplasm is of uncertain histogenesis, arising either in an ectopic or supernumerary breast tissue or anogenital mammary-like gland tissue. Around 50 cases of ectopic benign breast lesions and 20 cases of ectopic malignant breast neoplasm have been reported in the literature. The vulva fibroadenoma is seen between 20 to 80 years. It usually manifests as subcutaneous nodules or a mass. It is commonly solitary, mostly on the labia majora, seldom presents as vulva cysts, and very infrequently bilateral. The lesion usually measures 0.8 to 6 centimeters in size. The mass may increase in size significantly during pregnancy or lactation. Hartung described the first mammary tissue in the vulva in 1872, and since then these elements were considered as ectopic breasts representing the caudal remnants of the milk ridges. It was only in 1991 and then in 1994 that Van der Put proposed that this tissue represents a normal constituent of the anogenital area, which was supported by other authors. Fibroadenoma of the vulva was reported as early as 1947 and a few times thereafter. So this lady, she was presenting, every time she had intercourse, she would bleed, which led them to find this tumor, and when they removed it, they discovered it was this benign tumor made out of muscle, and then it started in 1872 when they found the first one.